gonna attempt to open up this PowerPoint. Can you see the PowerPoint?
Yes.
Okay.
If anybody else cannot, please chime in here.
Okay.
Thank you.
Thank you everyone for joining. I think downstairs I'm getting confirmation they can't hear us, but they can see me. We're running the Zoom. Sorry, I'm going to give them a minute to see if they can get the volume on. I promise y'all that are on this line that we've done this before, and we have a very organized talk, and I'm really sorry. No, no, they can't hear me yet. I'm going to give them just like another minute just to try troubleshoot. Okay. Thanks everybody. 1 minute.
Mommy? Okay.
Can you hear us now yet, guys? Anything down there?
Okay, I'm gonna go ahead and try some of this talk. And since it's recorded, maybe they can check out the talk later, or I can pass them my slides, but hopefully they get it going soon. I'm texting with them now. Okay. So my name is Mary Caldwell. I'm one of the physicians with VCU. I work alongside with sports backers for the medical coverage for the marathon. I think this is my 4th year as medical co-director of the marathon. I work alongside the emergency medicine doctors. So it's sports medicine doctors, emergency medicine, a lot of fabulous nurses, PTs, athletic trainers, OTs. Yeah, I mean, we have a MAs, LPNs, a slew of people that help us in that tent. I am at the main finish line. Hopefully, if you're listening to this call, we could have crossed paths before, but hopefully we do not cross paths on marathon day. I come from a background of running Division I track and field, and I'm a middle distance runner. I've covered a lot of marathons, including the Chicago Marathon, the Marine Corps Marathon, the Baltimore Marathon. There's a lot of marathons that I've covered, and I've done them many years in a row. The main purpose of today's talk, in my part, is to keep you guys safe. So there's a lot of injury prevention that Chris is going to go through. We're going to talk a little bit about some of those common injuries and the common sites. But we're especially going to get into emergencies in running medicine, and especially with marathoners. And they can hear me on a phone down there with volume. Thanks, guys, for chiming in. So for the first part, epidemiology of running, over 30 to 40 million runners worldwide. A novice runner is someone that I consider that's only been running for less than 3 months. And then we've got those recreational or pro runners that are running for more than 3 months. Average age of runners And I know pro is obviously someone that's been running more than 3 months, but and hopefully many years into that. Average age of runners is actually trending up. So average age is about 35 to 40 years old. And in the marathoners and ultra runners, it's even higher than that age group wise. In injury and how we determine if something is considered an injury is if it interrupts the hours of training. And so we use these numbers and we'll throw them out there. And a runner that's just beginning, someone that's lost over 33 hours of training per 1,000 hours is considered a standard. What does that mean to us? It just means that if you're a new runner and you get an injury, you're going to lose way more time than someone that's a pro runner that gets an injury and that tends to recover better, typically because they've been doing it for longer. A retrospective case analysis that we've done a lot of studies on overuse injuries, and this is one of the biggest ones that was published. Overuse injuries, the number one being knee pathology, right? So patellofemoral pain syndrome, what does that mean? The way that the kneecap is tracking or the way that the kneecap moves when you run. And it can cause this anterior, medial, sometimes lateral knee pain. And that's the most common thing we see. And that can come from a number of different reasons. Sometimes it's a strength deficit in the glutes or a strength deficit in your quadricep muscle or too much tightness in your hamstring. It's usually a number of things. Next thing we see often is stress syndrome in the shins, right? So shin splints, but that is a spectrum. Shin splints, just because I have shin pain doesn't mean it's just shin pain, meaning how the muscle is pulling on the shin bone and causing this pain that as I warm up is actually getting better, but then hurts when I'm done. Versus someone that has a stress fracture there, whereas as I'm running, this is getting worse, getting worse, getting worse, getting worse, and you could actually have damage to the bone at that point. And we usually like to see you if you're having persistent pain and it's not responding to some of the stuff that Dr. Phone, our therapist, is going to teach you. Achilles pathology, IT band syndrome, that lateral giant band of fascia on the side of your leg. And then we talked about stress fractures of the tibia, and then foot pain is one of the other common things like plantar fasciitis. So mainly overuse injuries is what we see. Risk factors for running injuries, number of things. We think that there's a correlation to basically the number of miles that you do per week. Those running about 19 or 20 miles a week versus, so like it depends. These seem to be the peak periods. So someone that's hitting about 20 miles or more, but especially someone that's hitting 40 miles or more is at risk. So it just depends on where you classify middle distance runner, long distance runner. Prior injury running in the last 12 months. So someone that's had a prior injury is at risk for a second injury. I think we know that well. An inexperienced runner, like we talked about. A recent transition in your training. So something that's changed. I increased my pace. I increased my duration. I increased the mileage. Something that's changed. I changed intensity like we talked about, or even the way the foot is shaped can be a risk factor for running injuries. Things that we don't think really, we're not sure if they make a difference for running injuries. Your flexibility. I think that's always a shocker when we talk about it, but it has not been shown to change injury rate if you're more flexible than someone else. Shoe type, could go on for days about many of these, but there's not been great evidence that the type of footwear you're wearing makes a huge difference. Orthotic type, again, not saying I agree with this, but not great evidence. Road running has not really been shown to be a risk factor. So go city runners. Malalignment problems. I think that's the number one thing people come in and say, well, my pelvis feels a little bit off or this leg feels a little bit. That's not a risk factor. I don't blame malalignment for problems. I think that everyone has a portion of malalignment in their body. That's normal. Your joints are meant to sit and move in different places. BMI has not been shown to be a risk factor for injury. And most importantly for us aging athletes, which is defined as an athlete above the age of 33, not a risk factor. Certainly, definitely not a risk factor is gender, the time of day that you choose to train, adding cross training, not a risk factor, and then warming up or cooling down hasn't been shown to correlate. In general, I like to, and this is what the textbook teaches us and how we kind of preach it. If you're running with a pain level where you're limping, that's bad. Come see me. Increase mileage more than 10% a week. If you do it faster than that, you're at risk for an injury. You can use a pain score if you want, 3 out of 10, 4 out of 10. If your pain is above that, it's very subjective, right? Go for a long run that's more than 30% of your weekly mileage. That's a bad idea. Build up to that. The reason, especially the main reason I'm here today is to talk about emergencies in running medicine. And we're going to talk about two things briefly: sudden cardiac arrest and then heat injuries or hypothermia. So sudden cardiac death in runners, it happens, it's quite common actually. Age 35 and less can happen up to 280,000 runners a year. In marathons, we see it at a rate of 1 per about 55,000 runners. In that age group, it's oftentimes a problem with the structure of their heart. We hear about the basketball player that collapses on the court, very similar in runners. That's called hypertrophic cardiomyopathy or HOCM. It also happens in runners in this age group. Another thing is called a coronary artery abnormality. It's the way that the arteries are formed on the heart. And then a recent viral infection, myocarditis, which is where the heart lining can get inflamed, which we were seeing post-COVID, which you can see it post-flu. You can see it from a number of viral infections. So if you're out there, I want you to run as healthy as possible. Please don't run if you've been sick recently. Age 35 and 40 is kind of a range group, but 40 and up for sure. The number one cause is coronary artery disease. Again, you heard me say aging athlete, master athlete, depending on the textbook, somewhere between the age of 30 and 35, sorry, 33 and 35, we're defined as, I'm in that category, the older athlete, right? Your peak athletic performance is actually up to that age group, and then we see a decline in your athletic performance until about age 60, and then it just gets rapidly declines after that. I'm not saying you can't do it, keep fighting, push hard, but we're up against a lot of things as we continue to age. Sudden cardiac arrest in runners, 80% of those who suffer cardiac arrest will do so in the last 25% of the race. Men are 5 times more likely than women. And then runners under the age of 40 are 7 times more likely to survive, usually because it's one of those things that the defibrillator can reverse or bring back from an arrhythmia, whereas the coronary artery disease is a bit harder to intervene in that moment. Prevention of sudden cardiac death. So there's a lot that goes into this, and there's a lot of different societies that weigh in on this. In general, if we're looking at a very popular one, the American Heart or the World Health Organization, they define it as in males that are 45 or females that are 55, those that have a high risk profile for coronary artery disease that want to participate in vigorous activity. So that means I'm running, I can't talk while I'm running, that's vigorous activity, that they should get some type of exercise testing done. It's really important. This is not like, this comes from a lot of evidence. If you're in that profile and you have a high risk, we want you to have an exercise stress test before coming out on marathon day. You can get that ordered with me, you can get it ordered with your PCP. Those factors and what makes you at higher risk, I'm going to show you. Family history of somebody that's passed away from a sudden cardiac death under the age that you see on the screen, either 55 in a male or 65 in a female. Somebody, you personally are a smoker, current or quit within the last 6 months. Hypertension, so you have high blood pressure, or you're using a high blood pressure medication, high cholesterol, blood glucose that's been elevated on 2 different occasions with fasting, above 100. Obesity greater than a BMI of 30, and then a sedentary lifestyle. And I don't think that's anybody on this call, but someone not partaking in what's expected of the average exercise a day. So prevention of sudden cardiac death in the young athlete, really critical. An aging athlete, young athlete, we do sports physicals. You get a physical with your primary care doctor annually. It's easy. It's a matter of asking questions, making sure they're asking the right questions about your cardiac history, getting your cholesterol checked, making sure you don't have diabetes, avoiding smoking. And these are all things that we do pretty routinely for our athletes to make sure you're safe. Heat illness. So probably the number one thing that we see as the temperatures have been going up on marathon day. So definition of heat illness, it comes from many things, but why does it happen? So your body heat is gained from the environment and produced by your metabolism. So you can imagine if it's much hotter outside, you're already producing a lot of body heat, it puts you at increased risk for heat stroke. There's lots of ways that heat evaporates and dissipates, right? So sweating is one of them, evaporation, another one. Coming in contact with something cool, like splashing water on your face. Yeah, okay, not a physics lecture. Heat tolerance definition. So this is the ability to compensate to heat, stress, and sustained work, you have to come out there trained in the heat. You have to be climatized to what you're going to run on marathon day. So if you're running out there in the heat right now, you are getting your body used to sustaining those heat and those body temperatures. This takes weeks to do, usually a matter of at least 2 weeks to 3 weeks to get your body ready for heat training or for marathon day, especially with Richmond's recent temperatures. Difference between heat exhaustion and heat stroke. So someone can have heat exhaustion, right, where they're feeling tired, they're headache, they're feeling weak, their pulse is going up, they're very uncomfortable outside, but it can transition into heat stroke, right? So this is when the organs start to shut down. Body temperature goes above 40. You can have seizures, unconsciousness, cardiac arrest. It's quite dangerous, nausea, vomiting. But these people are usually quite confused when they come into the tent and usually brought in by someone running alongside them or someone witnessing what's happening. They just don't know what's going on. Again, core temperature greater than 104. Oftentimes, again, confusion, could have seizures. And what happens is when they go into this heat stroke, your body says, okay, well, let's save all the blood flow and try to get it all to the core organs, the heart, the GI system, and it constricts blood flow from all the limbs. And it's not the right response, but it's trying to save you. In general, the data from heat stroke comes from military. That's where we see it most commonly. Affects males more than females. Again, I think that's a military skewed bias number, but then the age groups, it can happen quite young. We talked a bit about this. Temperature is typically greater than 104. Why do people die and when do people die? 100% of the cases where people have died in this across the nation have been because there's been inappropriate medical triage. So attention wasn't given right away, it was missed. These people can't be transported by ambulance. You have to be treated immediately with some type of cooling strategy. If you triage someone and you miss it and you don't check a temperature, which is a rectal temperature, and they're confused, and you send them off in an ambulance, within those 5 minutes, they can seize and die and you can't bring them back. So you get a window to do this, and this is what we are doing in the medical tent. This is why you come and see us if you're feeling off or if you see someone you're running next to is feeling off. In general, we monitor temperature outside to make sure that it's safe for you, right? That's part of my job. We are watching what the temperature is, and we use that with something called a wet bulb globe temperature. And we're looking to make sure that the race temperature, when we use this wet bulb, and I'll show you this in a second, isn't greater than 70 degrees Fahrenheit. And there's a lot of things that come into play with this. The wet bulb globe temp is a device that looks like this. We're using, it picks up different things. So natural temperature, a black globe temperature, and a shade air temperature. And the idea again is bringing it all together. What is the direct sunlight temperature? What is the wind factor with that? What's the shade factor with this? And so it brings into a lot of factors. Again, like we talked about, we use that temperature to determine if it's safe for you to race and give you a warning. There will be a flag system that we implement on race day, which will show you if green is go, green is great, go enjoy it. We don't expect any issues, but you might notice that the flags might change to low risk, which just means the temperature is getting a little bit higher. And that typically means for a pro runner, maybe be careful that this condition could get worse and you might need to slow down a bit. And if it hits high, we recommend most people slow down. And if you're a new runner and it's your first marathon, you may in fact want to stop. It could be quite dangerous to continue. Red would be a race cancellation, or black would be race cancellation. So again, the key for this is cooling. We have these giant tubs at the medical tents so that if someone is in heat stroke, if the temperature is high and it fits the right symptoms, we will dunk you in a tub and keep you in that tub. It is quite cold, but it will save your life. So that is it. That is my part of the talk for today. We talked about some common running injury sites, the risk factors and the myths for risk factors for running injuries, and then emergencies in running medicine, our approach to the class athlete, but that we're making sure it's not two of the most important things we don't want to miss, which is a cardiac event or heat stroke. So thank you everyone for your time, and I'm going to go join everybody downstairs. Chris, if you're there, I'm gonna pass the baton. But I think you're still on mute. There
We
you
have
go.
we have audio.
Good, there's an echo, but I'll turn mine off.
Okay.
All right. Well, I think we're okay then. That's wasn't sure we were going to have any audio in the room here. So so we have some people with us here as well for some of these exercises too. If anybody wants to do any exercises, you feel more than welcome to, right? So we can always get you guys up here. So I've made this presentation a few different times with the marathon team, the half marathon team, and what I kind of decided to do this time was to change it up a little bit. And what I'm going to present are more common running injuries or preventative or exercises that will help prevent some of the common running injuries that we have. Excuse me. Strength is always the king, right? So stretching is great. It might feel good, but in the end, really what we want to make sure we're doing is strengthening. And we want to have an external load because as runners, we run and, after a few minutes, 5 minutes, our body kind of just doesn't feel any of that bounce, any of that pounding against the pavement. It kind of becomes white noise. So when we're doing our strengthening, we have to load our system. If we are just doing body weight, which runners always love, I'm going to do some body weight because that's what I do. It's going to be kind of a white noise to our body. It's not going to make that much of a difference. So we have to load our system externally. We have to kind of lift some weights, even if it's a 20-pound kettlebell, which is what we're going to use today, right? That is that's a little bit more weight to our system. It's going to help just to start to stimulate some, kind of muscle building, joints. It will stimulate the bones. And as runners, and especially when we're training for these long races, we want to make sure that we're protecting our joints, protecting our bones, and basically being as healthy as we can. The other piece that we have to kind of expect a little bit there is, with running, we're going to have some pain, and if we're already having some injuries, we might have some stuff that doesn't feel great. And it's reasonable to train through some pain. Ideally, what we usually talk about is 5 or below on your scale of 5 out of or 0 out of 10. Ideally 3 or below, but 5 is okay to train through at this point. The other thing we always want to think about, though, does it reset to back to 0 or baseline, let's say baseline in 24 hours, because that's really significant to know whether we are appropriately pushing our limits. If we have any ramping pain, if we have any increased pain, a little sharp pain, we're probably pushing a little bit too far, and maybe we need to adjust our plan at that point. The other piece of the puzzle is, sometimes if we have bone pain, that deep kind of pain, that stuff that doesn't relate to like any of our activities, but it's just kind of throbbing when we're sitting there, or when we're trying to lay. That's one of those issues that we cannot train through. Bone pain, stress fractures, stress reactions. We have to go see our medical providers because we're going to have to take some time off at that point. And that's just one that if you keep on training, those bones will just turn to mush over time, right? So we just got to make sure that we are kind of doing the appropriate checking in on our system. Is this kind of a reasonable pain? And not pushing our limits to where we then lose the whole season at that point. I think that's the main gist of what I really want to get. The other piece of the puzzle is strength training, right? We want to make sure that we're doing it at least 2 times a week. During your running season, it's hard to feel like you can get enough time there. But you still need to spend 15-20 minutes. It doesn't have to be long. You have to have like a core, kind of set of exercises that you're going to be consistent with, and that you can manage, that you can fit into your life. But 2 times a week is pretty reasonable. As we get closer to race day, you might break it down to 1 time a week at that point. If we have an off season, hopefully we all have some off season, we're maybe doing it 3 times a week. So strength training is one of those really valuable pieces that we can't just ignore in the end. So that being said, let's go through some of these exercises that I wanted to present to you guys. All right. So in general, what I always want to there's 3 exercises that I think are pretty pertinent to do kind of long-term and just preventatively. So I always want to load our system from up above. We want to load our system from down below, because those are the 2 things that we do functionally in life, as well as kind of it's what's related to running. So ideally we're going to be able to squat. External load, 20 pounds is a good amount here. And, we're just going to take, I guess I should move up a little bit here. It's going to take a load up high, and we're just going to try to squat down, get low. Now, it doesn't, squatting, people always think that, there's one perfect form for squatting. There's no perfect form for squatting. We want to protect our back. What we want to do is go within what normal movement range that you have, right? So, so it just should not be painful after the fact, right? So with the weight here, getting down as low as your body allows, all right? You can always increase range of motion. Some stretching, like I said, that's the appropriate piece of the stretching, right? To increase some range of motion to allow us to do these exercises maybe a little bit better. Next one is a deadlift. So starting from low down, we're going to lift the load up to kind of waist level here, right? So just getting down to where you feel comfortable each time. So loading from above, loading from below. The third one that I like and that I tell everybody to do, whether you're hurt or not, is like an anterior tap down, right? So this exercise is what we do as runners. We're always catching ourselves, slowing ourselves down. So what we're going to try to do is tap our heel down in front of us. Eccentric control for the quad at this point, and good for catching ourselves when we run. We land on the leg and we're trying to slow ourselves down so we don't collapse down. So 6-inch step, we can move up to a 8-inch step if we have available, and just tapping down. Another version of it is multi-directional. A lot of the trail runners I will give this to, especially because the trails are less flat. Roads aren't flat, trails definitely are not flat. So tapping the heel down, tapping the toe down, tapping the toe around. So go through that range right there. You're gonna get good work for your quad, you're gonna get good work for your calf, good work for your hip. So those are our 3 kind of general exercises that I want everybody to do in general. So if you have plantar fasciitis, or if you've had some of that foot pain, a few of the exercises that I like for that are basically what we're going to try to do is treat some, let me see here. Yep, over here is good. We're going to try to treat your plantar fascia like it is a tendon here. We want to extend our toe up for this exercise, right? So we put that plantar fascia on a stretch already. And then what we're going to do is we're going to do a heel rise as high up, slowly back down. And what we're trying to do is treat that fascia like it's a tendon, load it, because loading has been shown to really make it more durable, basically. Slow up and slow down. 3 times a week, 3 sets of 8. 3 sets of 10, 3 sets of 12. That's what we want the progression to be. All right. So the next one we're going to do is, this one might be a little bit harder to see. I'm going to pop off my sock here. All right. Is toe yoga, right? So this is basically where we're going to lift the big toe up, and then we're going to lift the outside toes up. Big toe, outside toe. We're trying to teach our foot to work functionally. Fingertip on the wall, big toe, outside toes, big toe, outside toes, trying to get the intrinsic muscles of the foot to work better. Another one for plantar fasciitis is what we call short foot. So what we're trying to do is we're trying to draw the ball of our foot towards the heel. And we're not curling the toes under. People like to curl those toes under. We're trying to work these short muscles inside the foot. So we're just drawing that ball of the toe towards the heel. That works all the muscles in the foot as opposed to the ones that originate from outside the foot. All right. 3 good exercises for plantar fasciitis. All right. So let me get my shoe and sock back on here. All right. And the next one we're going to look at is patellofemoral pain or anterior knee pain. So pretty common, I think we've all, as runners, experienced some type of knee pain somewhere along the way. And so, whether you're experiencing this or whether it's just something you've had in the past, we want to work on some strength for that. So I like, first of all, step ups, right? It's going to work kind of that whole system. Going to work the quad, going to work the glutes. Glutes are always important for any type of control for the knee. So coming on up and pausing and back on down. 12-inch stool, 18-inch stool. You want something that is going to be high enough to challenge your system a little bit. If that is easy, you can always add a kettlebell, opposite side, boom, up. And you get a little bit of a load in there like we talked about. All right. So we talked about the anterior tap downs, patellofemoral pain. That's that pain that you have at your kneecap. Anterior knee pain is kind of similar area. Pretty common with runners. So we have that anterior tap down, which is a little bit tougher. Sometimes people with anterior knee pain don't like this one because they're like, pretty painful. So let's make it a little bit easier. Let's lower the step down. And even on your front steps at home, you're just going to go laterally. And you don't need, most steps are 7 inches. You don't have to go all the way to the bottom. Just go to where you feel controlled and pain-free. We're always looking for like a pain-free zone, basically. So, all right. And then, like we talked about, love hip strength for any kind of knee pain. So we're going to try a side plank. And what we're going to do with the side plank, we're going to add a little hip abduction at the same time. So we're working the top hip, that's getting the concentric contraction, but we're also working this hip, the bottom hip, isometrically. If that's too hard, you just go from the knee. Same thing, get our core to work, and we're still working the hip at that point. All right, so 3 good exercises for anterior knee pain. Let's see here. So hamstrings. All right, hamstrings are very common as well. Most people, hamstrings are a little bit weaker than your quads. And those are the ones that usually people strain when they're trying to do some speed work or they're trying to do a little bit more hill work, right? So preventatively, we want to kind of try to strengthen those ahead of time. But if you've already injured that hamstring, or if you have some vulnerability at it, start adding these exercises into your program here. So first one is making sure we can still see. Yep. All right, single leg bridge. So the single leg bridge here, we're going to extend that leg out and we're going to bridge on up there. You get work from your core, you get work from the glute, you get work from the hamstring, all together there. All right. The next one we'll use the stool, and this is a little bit more of a challenge. So we're going to do a bridge on the stool with a little bit of a march. And on this one, you definitely will feel the hamstrings fire. This hamstring has to work hard on this one. So another version of that one. You don't have the stool, front steps. I don't have the stool at home necessarily. I use my front steps. Just put my yoga mat in front of there and do it right off of those, off the second step, something like that. So I'm going to see if this one works in here. You don't have to slide more up. Maybe this will work. All right. Or with your hardwood floors at home, you can do hamstring sliders. So heels on top of your hardwood, slowly lengthen out. This one, eccentric contraction for your hamstrings, and it will burn them out pretty quick. So 2 feet easier, 1 foot a little bit tougher. Okay, but you can just use your socks and your hardwoods, furniture sliders, whatever you have at home. Okay. All right. Perfect. Hamstring strengthening right there. Okay. So we are going to move over to glute med. So glute med is this lateral hip pain. So it's that pain where people are like, oh, this hurts, you know, is it bursitis? What is it? Bursitis in and of itself is not as common as weakness at the glute med. It is, I think, about 90% of the cases of bursitis have some glute med weakness, is what the literature reports. So you can see that's the big driver of some of that lateral hip pain. All right. So a good way to start with this one here is to do a long hold hip abduction, right? So what we're going to do is we're going to get down into that ready position here. We're not going to go to end range because then it's too contracted at that point. We're going to find that mid range, and what we're going to do is we're going to hold it for 30 seconds. Sounds like it's going to be super easy, and then you try it, and on rep 2 or so, people are like already feeling the big burn in that glute med at that point. So if you can see, this has probably been about 15 seconds, so we're still holding, but this will fire your hips up a little bit there. All right, and most of these exercises, right, you're trying to do them 2 to 3 times a week. So it's not an everyday thing. So even though there's some pain with some of these exercises, it's, you know, there's recovery time in between. And it's good pain. It's, you know, muscle pain, right? So, all right. Next one we're going to do is the lateral band walk. Everybody's done this somewhere along the way here. What I want you to think about always is you always want that band low down at your ankles, because that has more EMG at your hips. EMG is going to more muscle activation is what we're looking for. So you can put it at the ankles. You can even put it on the toes. The toes, sometimes the rubber band kind of drags on the ground. That actually is technically the most kind of active for the hips at that point. And you just kind of, and you know, people don't do enough of this. I always tell people 3 minutes. I don't care what the distance is, but do it for 3 minutes. Couple rounds isn't probably long enough. You want to feel some real burn on the muscles. All right, and then the other one that I liked with this one, we already kind of showed it, side plank with hip abduction. So back down there again, whether you're from here or from up here, we're just going to work the hips. The bottom hips working a lot, top hips working at the same time, right? So that is great right there. All right, that's lateral hip pain, glute med pain. A few other ones we will have, you know, kind of an anterior hip pain, you know, the stuff that's not localized right to this lateral hip, we kind of grossly will describe as hip pain as well, right? So lateral band walk, we just did that one. We did the step ups again with the hip drive for the glutes, right? This glute has to work hard each time, glute max, that's a big muscle. That's what we want to fire up when we're doing this. So that's a great one for hip pain as well. Another one that I like is I always describe it as an RDL, right? So take your back out of it, a little bend in the knee here, and then we're just going to tip over just to where we can control it, and then back again, right? So you get some balance on this one, you get calf work, quad, hamstring, and glute all working here. You know, and one of the big things we're trying to avoid with some of these exercises for the hips is any of that kind of that medial collapse of the knee, that popping that hip out. So, you know, what you always want to, nice if you're at the gym or at home to use a mirror for some feedback. Try to make sure you can keep your pelvis level, knee in line with the foot relatively. My legs are bowed. They're never going to stay in line. So, but you don't want a big, like, collapsing down, popping my hip out kind of moment there. If that's what you're going to get when you go real far down, just shorten it up. Shorten it to where you can control it for some of these exercises. Low back, there's another one that everybody gets a little bit of, right? Low back is one of the most common injuries that we see in physical therapy. So for runners, all that pounding, yeah, we're all going to have a little bit of some low back pain at times. This is one, look, I do like some stretching for your low back. If you have a history of some low back stuff, I like this combo right here to just loosen up your low back before you go out running. Just do a little bit of that trunk rotation, get that back and forth. Need a little bit of rotation to your back, need some flexion, extension, some side bend. And then do the open book. And this really doesn't take that long. You can do this right before you get up and get out running. You know, it's either one of those things that people like to do before they get out of bed, or they do it, you know, get some water and then do a little bit right then. And then the last one, just to wiggle your back loose, is a little bit of a press up. I don't care how high you go. Some people don't like it, a lot of extension. Go to wherever you want to go, hold for about 5 seconds, and then go into some child pose right here. And you go back and forth. So wiggling your back loose, back and forth, nice and easy. All right. So for strengthening for your low back, you know, there's obviously a lot of different versions of this. Yoga is a good kind of guide for some of the strengthening for your low back for sure. Maybe just, you know, not as extreme as some yogas are, right? But like dead bug, that is a good one right here. So you're starting at the top here, you're going to do opposite hand, opposite leg, drawing your belly button in, setting your pelvic floor, like with a 25% contraction, like you're shutting off the flow of urine. So nice and back and forth. Just to work, you know, our body's work on the diagonal, opposite arm, opposite leg go together. So we're just trying to work that diagonal in a nice, safe position for your back. Back, side plank we've done. Side plank is great for your back. We do a regular plank. You know, what I want you to think about with the regular plank is a nice flat back, right? So we don't necessarily want to do it where we're sloped from, you know, shoulders to feet, and then we sag out, and now we're hanging out our back joints. So we want that nice hinge at the hips, flat back up high. If that position doesn't feel as good, you can always come down lower, and you do it the same kind of concept, flat back and hinge from the hip. All right, I have a couple more for your back. Squats and deadlifts are already going to be one of the best exercises for your back in general. If you have some pain already, you got to start real gently, right? And range of motion is limited. We talked about that in the beginning when we did the squats, right? You don't need to get down into a seated position, you know, just go down to where you feel comfortable. Start with a lighter weight and just try to get that little bit of that form there. And then the deadlift, obviously, right? So always like to be able to, this is what we do in life, right? We pick things up off the ground, pick boxes up off the ground. So, you know, you gotta be able to lift the load from the ground. And the last one I like for your back a lot, because it helps to work some of the rotators. See if this works. I think it will. You can use a cable column at the gym as well. Stepping out. And we're doing a little bit of a ready position, and then we're going to push out. We're going to hold for a count of 5. And this really is going to work those rotators, right? Because your band's trying to pull you this way or the cable column, and you're using those rotators to kind of stabilize your body. All right, and then back in, push on out and back in. So I think those are the main exercises I wanted to show. I hope that provided everybody with at least something maybe that they haven't seen or thought of in the past. The other thing I would say, look, if you have any bone pain, right? It's stuff that just doesn't seem right. Definitely, get in to see Dr. Caldwell or your PCP or whoever it might be, because that's one we just do not want to play around with. And if you are concerned about your running form or worried that, maybe something is kind of affecting my, maybe I'm getting injured every year because of something I'm doing. Come see us. We have a 3D run analysis lab here at VCU out in Short Pump. And we love seeing runners out here. So feel free to come and join us here. All right. So I think that's the end of my piece of the presentation. I guess we might have some questions at this point.
We don't have any in the chat, but you can ask. Anyone does? If you have any questions, you can either come off mute or put them in the chat.
It was a little bit of a scramble to get this thing done today, but I think at least it turned out okay in the end. So thanks for all your patience here, and hopefully online it was decent.
I kind of have one, which
Yeah.
is that like tendon that's kind of behind your ankle at the bottom of your foot here.
Yeah.
I find mine gets kind of tight in the first like mile. I'm feeling it a lot. Usually it kind of works itself out, but like I'm just curious what you recommend for that. Like I usually go on like a stair and try to
Can you point your tendon again?
like right here.
Are you on your Achilles?
Yeah. So I think that definitely sounds like a good stretch for it, right? So one thing we didn't talk about really is how to do some of your stretching before you go run, right? You don't want to do any real long static stretches, because you're going to lose some of those elastic properties. If you're just sitting there and you're just kind of holding that long stretch here, that Achilles tendon is going to lose some of its nice rubber band qualities that we like, right? So what you want to do for that instead is, find your curb or your bottom step or something like that at home, and you want to do dynamic stretching. That's what you want to do prior to a run. So, you would kind of get there on the step and you would just oscillate back and forth. If you're already out at the stadium or something like that, and there's no, you can lean up against the fence and do kind of the same thing, oscillate back and forth. That's great for your Achilles tendon, kind of all that, loosen up the calf muscle. For hamstrings, monster walk is a good one. You get that quick stretch on the hamstring, so you kind of loosen it up. Or, the scoops, you can do some of those as well. Whatever works, as you're walking from your car, you can get your quad, just a little kind of quick stretch. You can see my quads are way too tight because I can't keep my legs straight. Back, warm up your back, get down, back, nice and easy. Take another step, warm up your back a little bit, especially into extension, right? Because that's where a lot of us want to avoid that piece. So that's a good way just to kind of from the car to where you're meeting your group, warm up a little bit there. Or front door down to the driveway. Anybody else? Okay. Well, good.
Thank you.
All right. Thank you guys for attending. We appreciate it. I always enjoy doing this. I know Dr. Caldwell enjoys doing this. We love seeing the runners. So, and we want to keep you guys running on the road because I know what I want to do. So hopefully I'll see you guys out there during the training season.
Great job. Thank you guys.
Thank you.
I think it's up there.
All right. Oh, I guess there's one in the chat there.
She just said thank you.
Okay, cool.